Good day, fellow learners. Once again, I'm your mentor. This is Mentor Ray. I'm a test preparations coach for more than 25 years, specifically for the NCLEX-style test. Okay, so I've been through that, and I've been through a lot of licensure tests that I've taken because it's actually my passion to create strategies for my students. So, what if when you're sitting in front of the computer, ready to take the test, you've understood your pathophysiology of almost all the disease conditions that anyone could think of, and then all of a sudden, boom, in front of your computer, you would actually be given a question that relates to palliative care. Something very basic, but sometimes we fail to focus on. It's because maybe we are not aware that it's being asked on the test. So today we're going to talk about palliative care, specifically the pointers that I'd like to highlight for you to know so that you can answer questions related to this concept if it does come out on the test. Okay? So before we proceed any further, I'd like to invite you to join us in this mission. Our goal is actually to provide free NCLEX-RN application review to 100 nurses this year. And I've had already several applicants through email, and I'm helping out some of them already get their dreams, specifically their American dreams, okay, rolling on. So I'd like them to focus their attention on test preparations as well as test application, because I know it requires a lot of resources in terms of time and money. So to help us achieve this, since I'm already shelling out from my own pocket, I would just like to ask you to please just watch and finish the ads in our videos. That's all you have to do, including this video. So thank you. Reminder, if you have some questions, you may actually send it through this email, mentor.raygapuz@gmail.com. Now, if you have some requests on topics which you may want me to cover in my future videos, please send me a note into that same email. I've gotta do, so I'm not crying. Okay, so let's begin with the most basic thing about the concept of palliative care. So for you to do well in terms of analyzing questions as it relates to this concept, it would be very, very proper if you have an understanding of the definition of palliative care. And here is a definition according to the World Health Organization. So palliative care is an approach that improves the quality of life of patients and their families, facing the problem associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. Things that I'd like you to be aware of when it comes to palliative care, specifically on the definition, would be this thing: the patients and their families. So palliative care is not just specifically for the patient, but it is also extended to their families. Okay? Now, aside from the definition, it's also very important that you go through the principles involved in palliative care. Okay? So first and foremost, it provides relief from pain and other distressing symptoms, affirms life and regards dying as a normal process, intends neither to hasten or postpone death, integrates the psychological and spiritual aspects of patient care, offers support system to help patients live as actively as possible until death, offers a support system to help the family cope during the patient's illness and in their own bereavement, uses a team approach to address the needs of patients, their families, including bereavement counseling if indicated, will enhance quality of life, and may also positively influence the course of illness, is applicable early in the course of illness in conjunction with other therapies that are intended to prolong life, such as chemotherapy or radiation therapy, and includes those investigations needed to better understand and manage distressing clinical complications. So, in a nutshell, when you say palliative care, it provides a support system that addresses psychological and spiritual needs of both the patient and the family, utilizing a team approach to enhance the patient's quality of life. And take note, it's not just done towards the end or near-death experience of the patient, but it is done early in the course of the patient's illness. And it could also be done in conjunction with treatments that are intended to prolong life, like chemotherapy or radiation therapy. So there's no need for the patient to stop undergoing these types of therapeutic interventions while palliative care is actually being implemented. Okay, now let's try to figure things out and let's apply what we just have learned, okay, by trying to answer a sample question. Here it goes. So suppose you have this question in front of your computer, and all of a sudden, it seems like what you've read eventually is just presented to you in question form. So let's get through it. So which of the following statements about palliative care are true? Select all that apply. First one, it can be done in the early stages of illness. We just have learned this a while back, so we put a check. It involves the patient and their family. That's what I'm trying to highlight a while back, so we put a check. It is an individual approach. What we said a while back is that it is a team approach, okay? So it actually integrates both the psychological and the spiritual needs of the patient. So this requires a team approach, okay? So we put an X for this. Number 4, chemotherapy needs to be completed first before palliative care is provided. What did we say a while back? That palliative care could be done in conjunction with other interventions that prolongs life, like chemotherapy and radiation therapy. So we put an X for this. And last but not the least, it involves the spiritual aspects of care. Yes, we put a check, okay? So what is important, therefore, that you have to remember about palliative care would be not just a definition, but the principles. Now, having that NCLEX mentality, the thing that I keep on parroting about when I'm actually coaching you, okay? Remember, do not just stick it out with what you have read on the superficial. Dig deep. So adopt the what if mentality. What if it's the principles of palliative care as it applies to other population groups like pediatric clients would be the one that you're going to see on the test, okay? So for you to feel more confident in taking your test related to this concept, let's get through the principles as well as the definition of palliative care as it applies to the pediatric patient. So palliative care for children is the active total care of the child's body, mind, and spirit, and also involves giving support to the family. The principles of palliative care in children, it actually begins when illness is diagnosed and continues regardless of whether or not a child receives treatment directed at the disease. So whether a child is given other forms of treatment like chemotherapy or radiation therapy, palliative care continues when illness is diagnosed. So health providers must evaluate and alleviate a child's physical, psychological, and social distress. Effective palliative care requires a broad multidisciplinary approach. So the specialties of other professionals should be brought into the situation. That includes the family and makes use of available community resources. It can be successfully implemented even if resources are limited. And it can be provided in tertiary care facilities, the community health centers, and even in children's home. So this is shout out time once again. Allow me to congratulate Trixie Del Rosario, is now a resident of New Jersey from Iloilo Doctors College. That's where she got her bachelor's degree in nursing, and she's now in New Jersey, USA. And she actually selected the Hawaii Board of Nursing to be licensed in. So congratulations, Trixie, for joining us in our online review, NCLEX-RN methodologies, as well as coaching and the entire course that we did for you. It's our pleasure to have served you well in your quest to realize your great American dream. Once again, our pleasure to be part of your success. So for those who would want to become USRNs, let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. And if you have any requests for topics which you may want me to cover in my future videos, email me any concept which you may want me to create a content for you for your classes at this Specific address, mentor.raygapuz@gmail.com. So disclaimer, the instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCESBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN. See you in my next video.